Hey everybody, welcome to Medical Doc. Myself Sarang Jagtap and today we are going to talk about what happens during a stroke. So let's get started.
You stole my heart of gold after my silver soul. Can you dig any deeper now?
Every 2 seconds, someone somewhere in the world experiences a stroke, and 1 out of every 6 people will have one at some point in their lives. Stroke deprives brain cells of oxygen and are one of the most common causes of death and leading cause of preventable disability. When someone experiences a stroke, quick medical care is critical and can often help avoid permanent brain damage. But what causes stroke in the first place? And what can doctors do to treat them? The brain makes up just 2% of your body's mass, but consumes more than 20% of oxygen in your blood. That oxygen is carried to the brain through a system of arteries. Carotid arteries supply the front of the brain and vertebral arteries supply the back. These are connected to each other and divide into smaller and smaller vessels that get billions of neurons the oxygen they need. If the blood flow is interrupted, oxygen delivery stops and brain cells die. There are two ways this can happen. But the more common type is ischemic stroke, when a clot blocks a vessel and brings blood flow to a halt. Where do these clots come from? On rare occasions, a sudden change in the heart rhythm prevents the upper chambers of the heart from contracting normally. This slows down the blood flow, allowing platelets, clotting factors, and fibrin to stick together. The clot can be carried up towards the arteries and blood vessels, supplying the brain until it gets to one it can't squeeze through. This is called an embolism, and it cuts off the oxygen supply to all the cells downstream. The brain doesn't have pain receptors, so you can't feel the blockage itself. But oxygen deprivation slows brain function and can have sudden noticeable effects. For example, if the affected area is responsible for speech, an individual's words may be slurred. If the stroke affects a part of the brain that controls muscle movement, it can cause weaknesses, often just on one side of the body. When this happens, the body will immediately try to compensate by diverting blood flow to the affected area. But this isn't a perfect solution. Eventually, the oxygen deprived cell will start to die, leading to brain damage that may be severe or permanent. That's why it's important to get medical care as fast as possible. The first line of treatment is an intravenous medication called tissue plasminogen activator, which can break up a clot and allow blood flow again in the compromised artery. If it's delivered within a few hours, this medication greatly increases the chance of surviving a stroke and avoiding permanent consequences. If tissue plasminogen activator cannot be given because the patient is on certain medications, has history of a major bleeding, or the clot is particularly large, doctors can perform a procedure called endovascular thrombectomy. Using a fluorescent dye that illuminates the blood vessels under a strong X-ray, the physician inserts a long, thin, flexible tube called catheter into an artery in the leg, maneuvers it all the way to the blockage. A retriever is passed through the catheter. It expands and anchors into the clot when it's just past it. The catheter then pulls the clot out when it's removed. These treatments need to be delivered as soon as possible to preserve brain function, which means figuring out fast if someone is having a stroke. So, how can you tell? Here are three quick things to try. First, ask the person to smile. A crooked mouth or facial drooping can indicate muscle weaknesses. Second, ask them to raise their arms. If one drifts downward, the arm weaknesses is also a sign of stroke. Third, ask them to repeat a simple word or phrase. If their speech sounds slurred or strange, It could mean that the language area of their brain is oxygen deprived. This is sometimes called fast test, and T stands for time. If you see any of those signs, call emergency services right away. Lives may depend on it. And this was a short explanation about the stroke and what happens during a stroke. So, if you like the video, then press the like button. And if you are new here and you like what we are doing, then please hit the subscribe button. Signing out, Medical Doc.